There are three major conditions of the prostate that affect men. Prostate cancer has got the biggest press, of course, but the other two conditions are benign enlargement of the prostate that can cause urinary symptoms and inflammation of the prostate called prostatitis. I'm going to focus now on benign enlargement of the prostate. Most men, as they get older, develop some degree of enlargement of their prostate. Usually this causes no symptoms, but occasionally it does. And those symptoms are very familiar to men. They include a slowing of the flow, dribbling after you finish, having to wait for the flow to commence, running to the toilet, called urgency, and going frequently to the toilet, which is called frequency, or if it occurs at night time, nocturia. Interestingly, prostate cancer in its early stages is silent. So when you develop symptoms, it's almost always benign enlargement. The symptoms of an enlarged prostate can broadly be grouped into blockage type symptoms such as slow flow, hesitancy, dribbling, or irritative symptoms such as frequency and urgency. It's harder to treat the irritative symptoms than the blockage symptoms. If you have urinary symptoms, it doesn't necessarily mean that your prostate's the cause of it. Many urinary symptoms are due to other causes such as bladder problems, infections, inflammation, cancer of the bladder. It can be due to kidney stones. It can be due to infections in the prostate, and it can be due to bad habits. For you to be able to find out whether your urinary symptoms are due to an enlarged prostate, usually you need to go to your general practitioner or a specialist called a urologist to be able to work out whether the symptoms are due to your enlarged prostate or not. If they are due to your enlarged prostate, not everybody needs treatment. All that you need to do is make sure that it's causing you no damage. How do you do that? You do that by simple tests such as how many symptoms do you have? Does the ultrasound show that you're emptying your bladder properly? How slow is your flow? In the case of a reasonable flow, good emptying of your bladder, and mild symptoms, most people will simply monitor their situation. Feel reassured. 20 to 30% of all men develop mild urinary symptoms as they get older. If you have mild urinary symptoms, these are the things you can do. You can regulate the number of times you go to the toilet, something that's called bladder training. You can modify your fluid intake. You can check all your medications which may be causing your symptoms. You can take some mild herbal therapy from your local chemist, which sometimes helps mild symptoms. You can understand that tea and coffee and alcohol can all have an effect on your bladder, and maybe you can modify those things. What can you do if the symptoms become slightly more severe, what we call moderate degree of bother? Well then, besides the usual education and behaviour modification that I just mentioned, you can add in a tablet. These tablets are of two categories. One is to relax the prostate, and they're called alpha blockers. They take the form of tablets which are known as Flomaxtra, Minipress, or Zatral. The other group of medications for people with moderately severe symptoms are what's called the 5-alpha reductase inhibitors. They're commonly known as Duodart, Avodart, or Proscar. Now, these shrink the prostate down and are generally reserved for people with an enlarged prostate who have urinary symptoms, but they are associated with slightly more side effects, particularly in sexual function, such as decreasing volume of ejaculate and possibly affecting erections. What other things might cause urinary symptoms? Well, there's a special area called nocturia, which means getting up a lot at night time, which seems to have a whole different group of conditions causing it. It might be drinking alcohol before you go to bed. It could be drinking too much fluids at night time. It could also be a side effect of your medications. It could be medical conditions such as diabetes or heart failure. And so getting up at night time does not mean you've got benign enlargement of the prostate, and usually has to be investigated totally separately. So when would we revert to some type of surgical treatment to treat benign enlargement of the prostate? In general terms, it's when you have more severe urinary symptoms or where conservative measures such as tablets either don't work or can't be tolerated due to side effects. What are these treatments? Well, they range from minimally invasive therapies all the way to a transurethral resection of the prostate. All of these are aimed at unblocking the blockage caused by the enlarged prostate. Which treatment might be suitable for yourself? This is something that requires a detailed discussion with your urologist. The options include various simple therapies such as Urolift procedure, embolization of the prostate, moving forward to laser therapies with green light or holmium YAG laser, and moving forward to transurethral resection of the prostate. Tailoring the treatment to your particular situation is paramount to give the maximum benefit and the minimal side effects. Some of these treatments are relatively new and some even experimental. So a full discussion of the various merits of every treatment in your particular circumstance is important. And against that, you have to measure the potential side effects and durability of the treatment in terms of long-term cure of your symptoms. Transurethral resection of the prostate remains the gold standard for unblocking the prostate in patients who have more severe symptoms. This basically is a minimally invasive treatment which shaves a channel through the prostate and requires 2 days stay in hospital. It has a long track record, excellent success rate, but it causes a condition called retrograde ejaculation, which means that every time you ejaculate, no fluid comes out. This is not harmful, it is irreversible, but it is a likely side effect of the treatment, which is highly likely to cure your condition. It has no other health implications on you. Other side effects of TURP done by an experienced clinician are rare. So exactly what are the side effects of transurethral resection of the prostate, or as we call it, TURP? 1. A greater than 50% chance of retrograde ejaculation. 2. A chance of intermittent bleeding over the first 4 weeks. 3. A chance of scar tissue in the urethra called a stricture. Again, this is a low percentage. 4. A minimal chance of incontinence, particularly minimal in experienced hands. And 5. A very small chance of erection issues, again in more inexperienced hands. And finally, a 1 to 2% chance of erection problems, generally in people who have pre-existing erection issues. One of the new treatments which shows great promise is the UroLift procedure. It started less than 5 years ago and has been subjected to very stringent trials. It's shown that it has a high success rate in certain people and it avoids retrograde ejaculation. It's suitable in those people with smaller prostates without a middle lobe extension of the prostate, but it's only been around for a short time, so as yet we don't know how long it's going to last for. So it's not really the gold standard yet, but it's something that a younger patient who wishes to preserve ejaculation may be reasonably advised to have.